Bismillahirrahmanirrahim. I am Muhammad Sadil Islam Sarkar, again in front of you with my previous or last topic. The handling of dead body. How can we handle the dead body of novel coronavirus disease, or the dead body of COVID-19? There are some misconception, there are some misperception and misunderstanding regarding handling of the dead body of COVID-19. So, sorry to say, we have seen some scenario throughout the whole world in different countries, which was very unexpected, which was very sorrowful for we people. And I would like to say, don't take it other ways. I will not say that these are the common scenario, but there are some unexpected scenery we have seen through different TV media, that coffin is bringing by using ropes. That means coffin is taking or bringing from the isolation area to the burial ground, and using ropes for this coffin. Some coffins are have dumped without touching, uh, dumping from the vehicles directly without touching. Did not maintain any religious rituals, religious rites among many countries. Uh, I'm not making claim against those countries. I'm just saying that those scenarios were totally unexpected to people, because all lives, all dead bodies are respectable to we people. I'm just saying that some dishonor has done towards those dead bodies. Did not allow funeral preparation at funeral parlor in many countries. Didn't allow friends and family members to view or to see the beloved ones. It's very simple that we will have an intention to see our relatives, to see our father, mother, brothers, or sisters, or any other relatives, because he or they were very beloved to us, and we want to see or view their dead body for last time. But some countries didn't allow to see the dead body, and I will mention what had said by WHO or different organizations or doctors about the dead body. Side by side, I will come. Did not allow dead bodies in the locality, neglect and refuse the dead body of COVID-19 in some areas for burial. It is very tragic situations that the dead body did not accept by the local people for funeral procession, for burial procession to the graveyard. It was totally unexpected. It's not a common case. It has done in some areas that we have seen through the social media, through the TV media, or through some daily newspapers. So, what about our own attitude and our own behavior? What are we doing? What have we done previously? What do we do normally? It is our normal attitude that we are really frightening and fearing the dead body of a person, dead body of a patient. It's our normal phenomenon that we are fearing normally. And if it is by some infectious disease, if dead body is due to some infectious disease or due to some contagious disease, the degree of fearing, the degree of frightening is increasing more and more, that we might be infected by this dead body. This is our common phenomena. But the news of this infectious or contagious disease make us very timid, and consequently we are fearful from the dead body. But this is not true. This is just a misunderstanding, a misconception, and misperception regarding a dead body. And I have made this clear in my previous video about different contagious, different infectious diseases. And now today I will try to say what should we do actually with the dead body of some infectious or dead body of COVID-19, which can be defined as that is our misconception about the dead body or about the dead body of some infectious disease. It's just our perceived drawback that we will be infected. Without judging or without documents, we are misunderstanding a matter. And in this context, the disease COVID-19, in this context, the novel coronavirus. That is, we have some misunderstanding. We had some misconception regarding the dead body of COVID-19. So this is not true actually. This is just mistakenly belief that this will infect people generally, but with taking some precautions, it is possible to handle the dead bodies easily, to do some funeral processions, to do some funeral ceremony easily without having infection from the COVID-19 dead bodies. So today I will try to discuss about some questions, on some questions, and I will try to find out the answers of that questions or of those questions. For example, what are we doing towards the dead bodies of COVID-19 that I have mentioned? Why are we doing this? I want to say again that we are not doing this towards the all dead bodies, but some exception that I have said. Why are we fearing dead bodies? Why are we neglecting dead bodies or corpses for funeral procession, even in their own or local burial grounds? Why don't we maintain religious rituals in some cases and in many countries? Why don't we allow corpses at crematorium or burial ground? It's very tragic situations that some local people or neighbors didn't allow dead body in their local area, and they have refused to bring the dead body from the hospital or from the isolation area. What about COVID-19 dead bodies? I want to say again, what about COVID-19 dead bodies? It's really unclear. It is actually not clear. There are absence of some data regarding this. What about the COVID-19 dead bodies? It is not clear to us. However, just how long virus remains infectious in the dead body, we don't know actually. How long does the virus remain infectious in the dead body? In light of this finding, we and forensic scientists should take some precautions during handling dead bodies. Since we don't know about the lifetime, about the lifespan exactly of some virus or novel coronavirus in the dead body, so we people and forensic professionals should be very careful and should take precautions during handling the dead bodies of COVID-19. Usually, we know pathogens that kill people don't survive long enough to spread to others after the person's death. Simply we know that after death, pathogens that ultimately kill the person will not survive more, will not survive for long, to spread to others. Dr. Otto Young at UCLA, is a renowned scientist and professor, says it is not surprising that the dead body of the recently deceased COVID-19 patient might be contagious. It's not a surprising matter that the dead body of COVID-19 is contagious. Simply, that will be contagious. Dr. Otto Young also says, absolutely, a dead body would be contagious, at least for hours, if not days. That means he's saying that dead bodies are certainly contagious and absolutely contagious. But he makes this clear by another statement that the dead body means the virus will still be in the respiratory systems, or in the secretions or in the body fluids of the dead body, and potentially still reproducing in cells that have not yet died in the lungs. That is, he's saying that virus or COVID-19 virus will remain in the respiratory systems or remain in the secretions or body fluids of the dead body. And he is saying that potentially that virus can reproduce even after death in the cells, because cells will not be fallen in decomposition just after the death. So some nutritional activities is going on just for some being, just for some times. So in that period, virus can reproduce also. COVID-19's longevity in the body can be problematic, really problematic for people in the funerary industry. I mean, for the funeral industry people, it will create some problem in funerary industry. For instance, following reports that temples in Thailand were refusing to perform funeral processions for COVID-19 victims. That means, due to this contagious manner, due to this infectious manner, due to some false belief, temples in Thailand have refused to do some funeral activities towards COVID-19 victims. As of March 19 in Thailand, it has shown that about 272 people, including forensic practitioners, nurse, had tested positive with novel coronavirus. So they were confusing that these forensic practitioners and nurse in forensic care are not in touch with the hospitalized patient, are not in touch with the community. Normally, they are handling biological materials of the dead body of COVID-19 patient, or other dead bodies, or dissection during post-mortem. I mean, they are just handling biological material and corpses for post-mortem. And 272 in Thailand had tested positive with novel coronavirus. Alarming situations. So some precautions should be taken during funeral activities, during post-mortem activities for forensic practitioners, and also a nurse or some other healthcare providers involved in that processing. Now, I would like to say, why are we fearing corpses for funeral procession? Why we why are we frightening dead bodies? Why are we refusing dead bodies in our areas or in some areas? This is not a common phenomenon, some exceptions. At this time, the novel coronavirus has been extending its footprints across the globe. Whole world is suffering with this pandemic, with these panic situations. We have to avoid this misbelief, this misunderstanding, and these panic situations. There is no matter of fearing or frightening from the dead bodies of the deceased person. Unfortunately, sorry to say, we have seen that some leaders, some local people, and some miscreants refused to allow the dead bodies to be buried in their local graveyard. Mistakenly, they were frightening and fearing from the dead bodies. Mistakenly believe that these dead bodies will spread coronavirus within them. Mistakenly believe that these dead bodies will act as a hub for their own area. So this type of refusal have occurred in many countries and even in some localities of our countries. I don't want to mention this. Uh, Sorry to say, the relatives are saying sorrowfully that it was very difficult arranging burials. It was very obstacles. There were very obstacles in front of them. They have regretted by the local people, and they have faced a lot of problems during arranging burials of their relative. Neglecting the relatives of the deceased person by the neighbors seriously, scolding the relatives by the neighbors due to this COVID-19 patients, neglecting the family or all family members of the deceased person by the surrounding people. It's really very sorry. It was really very unanticipated and unexpected works by the neighbors. We have already seen through the media that people of the own society refuse to give the bathing or washing cot. I mean portable cot. Portable cot for washing the dead body and to carry the dead body from the home to the burial ground. Very unfortunate that local people have refused to give the washing cot or bed sheet or portable cot through which we are carrying the dead body from home to the burial ground. And one sorrowful scenery that we have seen, that three brothers have carried out the dead body of their other brother from home to the burial ground by their own shoulder. They have carried the dead body of their brother from home to the burial ground, and they did not get any cot from the mosque or from the society to carry the COVID-19 patient from home to the burial ground. It's a very tragic situation. We have seen a lot of painful situations. I'm again saying this is not happening every now and then, but has been happening. It's just a painful feeling of humiliation due to wrong and foolish behavior. I just want to say, and I mentioned this scenario or news just to mean that these are the foolish activities, these are the wrong activities of the neighbors. Due to death of COVID-19, family members have fallen the dead body on the roadside in many countries. We have seen that just for avoiding the negligence of the neighbors, some people have left the dead body of their relative on the roadside. Due to corona disease, wife has left the husband who was paralyzed and has been suffering from COVID-19. She had just left her husband at home and have gone to the village home. Due to corona disease, son has left his old mother in the jungle. What a terrific situation, what a miserable situation, what a tragic situation, and what a grievous situation. So, really unfortunate, really unexpected events. So, what about WHO says regarding the funeral procession, regarding the dead body, regarding the burial activities? Whereas WHO says we can do this burial, simply we can do this, or we can do all funeral processions by following their guidelines. According to their guidelines, we can conduct the burial of all dead bodies in our own burial ground, in our own graveyard. We can conduct burials even by following the religious rituals, even by following Islamic rituals and Islamic rites. Even we can say prayer of janazah for all dead bodies in case of Muslims. So we can do this by following WHO guidelines. They have said that we can do all those jobs with our dead bodies. Now, what should we do during funeral processions or during funeral ceremony? I want to mention about the statement of renowned doctor in India, Dr. Siam. The dead body cannot actively transmit. He is saying that the dead body can't actively transmit the infection, but the dead body of the victim is like any other surface. The virus remains active for several hours on the body surface. And he says the droplets that may have fallen on the victim's hand, clothing, or his face, etc., are the hot spots for transmitting the disease. If a patient died with COVID-19 during infectious period, the lungs and other organs may still contain some live virus. Dr. Siam also says the most important advice against any gathering that goes against the principles of social distancing is totally prohibited. There is no mass gathering that will break the principles of social distancing. Some relatives of the victim may also be in incubation period and may carry high transmission risk. He says new research suggests the coronavirus can last 3 hours to 7 days on surfaces, depending on the nature of the materials. Dr. Sham also says coronavirus lifespan on surface depends on various factors like temperature and humidity. I have mentioned in my previous video, but I would like to say again, uh, coronavirus can live on several hours to 7 days on some different surfaces. For example, on surgical mask for 7 days, on cloths for 2 days, on paper for 3 hours, on air for 3 to 8 hours, copper for 4 hours, plastic for 3 days, and on board for 24 hours, and on steel for 2 to 3 days. So, what should we do during funeral processions? We should maintain social distancing. We should not touch any surface. All relatives should have masks. Family members who are already infected by victim should not attend the funeral ceremony. No mass gathering that goes against the principles of social distancing. So, no more today. Some matters I will discuss in the next video, and we should follow the guidelines of WHO during funeral processions, during funeral activities, and we can simply do funeral activities. We can even say namaz janaza for Muslims, for safe burial, for maintaining Islamic rituals and Islamic rites. So I think no more today, more when we meet again with some another topic or the extension of this topic, inshallah.